I'm happy to talk to Pascaline Dupas today, who's an associate professor at Stanford University and who's going to give a talk today on the design and effectiveness of subsidies or public health subsidies in developing countries. Professor Dupas, most of your research is focused on developing countries and especially on the effectiveness of subsidies in different areas such as education and health. Can you briefly explain why subsidies work best or work especially well in provision of public health?
If you just ask people why they're not using products that could make them much healthier and therefore more productive and could prevent their children from dying, they tell you they don't have money. And indeed, most people in poor countries, especially poor people in poor countries, have very little cash on hand. They do not have access to credit the way most of us do. And so even like relatively small sums for us can be very difficult to accumulate over time. And because health is such an issue with a big disease burden, whenever people manage to accumulate a little bit of money before they are able to invest in the preventive products that cost maybe $5-6, an illness strikes and they spend whatever money they had saved towards curing that disease. And so there is this sort of like a vicious circle which makes it, when you earn very little money, very difficult to invest in health, which as a result make you also not able to earn very much. So in developing countries, the disease burden is higher. People have less money to prevent diseases, and so that's why subsidies seem necessary to be able to boost people out of this, if I may call it, bad health trap.
Mm-hmm. And what is the most cost-effective way to implement the subsidies? What share of cost should still be borne by the end consumer to ensure that he values the product enough?
So it depends on the context. So obviously all countries have a budget constraint, and poor countries have even a tighter one than other countries. And so if you just subsidize a product broadly to everybody, you may end up wasting some of your money onto some people who would be able to buy it on their own, or some people who may just take it because it's free but may not use it. And so you want to think hard about ways to implement the subsidy so that you target the product specifically to those who, absent the subsidy, cannot access it, and will put it to good use. And so depending on what product you're talking about, these issues are more or less salient. So in the context of malaria prevention, where I've done a lot of work, I found that actually it's not much of a concern, the issue of wastage. People do use anti-malarial bed nets, for example, to a great extent. So even if they are completely free, people who get one free do use it. So there's not really much of a concern of wastage. But for some other products, like for example, water chlorination, there is definitely a share of the population that is not interested in this product. And so if you just like drop it off on their laps for free, you end up wasting quite a bit. But if you just make people pay some non-monetary cost for it, then you can help screen. So here, if you make them pay something in cash, again, you have the same problem that many people drop off because they can't afford it, even though they would use it. But we found in some research with colleagues that if you make people pay in some other numeraire than cash, in particular in terms of time, because people who are the most cash constrained tend to be less time constrained. You can select this way people who will be putting it to good use. So there is not one fits all answer to the question. Essentially, depending on the products, depending on the information that people have, depending on the value of the product, how repeatedly you need people to go through with the behavior or refill the product, the optimal design is going to vary.
One of the problems of these subsidy programs is that poor governance and limited accountability among health workers can undermine the effectiveness of these programs. What agency problems are you facing in practice and how do you deal with them?
So there has been a number of studies showing that sometimes health workers in many different contexts may not have much incentive to be there on a regular basis in their health centers. As a result, customers are not going to come and seek services. Or it could be that if the products that you're subsidizing are very, very valuable, for health workers, there may be a temptation to divert some of them for their own profit. So we've actually investigated these issues in the context of subsidies for antimalarial bed nets in Ghana, Uganda, and Kenya. And we found that in this specific context, these issues are not so much of a concern. And so in particular, we find that a program that targets free bed nets to pregnant women manages to get over 80%, 85% of the eligible beneficiaries getting the product as they should. And we find very little evidence of leakage towards those who are not supposed to be getting the subsidy. And it seems to be a product and an issue that is so salient to the community that even health workers who are not necessarily extremely motivated through financial rewards or anything like that do find it important, even for their own personal well-being, to implement this program well. So again, depending maybe on the perceived importance of this program by the health workers, the importance of these issues is going to be more or less. There are definitely contexts where it's not so much of an issue, which is good news.
Oh yeah. I only have one question left. Most of your research is focused on 3 African countries, but can the results that you found also provide guidance for other developing countries?
So we try to always think about the specific characteristics of the context where a study takes place that will or not make it possible to extrapolate from that. Mm-hmm. So you want to, when you read a study like ours, you want to look at, okay, what do they say about the underlying information that people have access to? What is the underlying governance structure? And then based on that, you can think of which countries the results may or may not apply to. Mm-hmm. But then it's always important to realize that every context is different, and so my recommendation to policymakers is that they can learn from seeing what has been done, and that can help them maybe narrow the set of potential policies that they want to think about. But then which one in particular they should really push for, they may want to do a little bit of trial and error before they fine-tune it.
Thank you very much for the talk and for taking the time, and I hope you enjoy the rest of the conference.
Thank you.